Let's talk about some self-massage for the jaw. So these are often cases where in the jaw the muscles are so tight that it's creating a lot of tension, therefore creating shifting of the jaw side to side, or a kind of a C curve or an S curve that's coming out. So there's four major muscles that we're going to work on in treatment, but in self-care there's you can't reach a couple of them. So we'll start with a temporalis muscle, which is on the top. So from here it spreads on the side here and it connects all the way down into the jaw. So what you're going to do, you're going to use the pads of your fingers and you're going to work on the sides here. So you'll find some tender spots. When you find that spot, you're going to hold it, and from there you're going to open and close your mouth. Okay, so once you do that 5 to 10 times, then you can move to the next spot, and then you're just kind of working through this whole area. You can also use the inside of your palms as you're opening and closing your mouth too. Okay, so then you're tractioning upwards as you open, you're pulling down as it closes. Next muscle we're going to do, as you bite down, you'll feel two muscles stick out here. And so what you're going to do, that's the masseter. So you're going to use the pads of your fingers again, and you're going to push across this cheekbone and working through there. So when you're here, you'll find some tight spots, and the same thing, you're gonna open up your mouth. As you're opening up and closing, you're gonna push up as you open, and then pull down as you close, so that you can work through that whole muscle through there. The next part you want to do, make sure you wash your hands, especially during a time where there's a lot of viruses and everything in the air. So in terms of this, you want to make sure that they're clean and that you can work on it. I like using a cross mouth approach where you're crossing into the jaw. So from here, you're going to use the pad of your thumb. You're not putting it in between your teeth because that's too hard to get into. So in terms of this, you're just going to go inside the cheek. So from here, you're going to put your hand in, and as you bite down, you'll feel that that masseter muscle on the inside is also tight. You can pinch it, and from there, you're going to massage downwards, pinching from the outside and the inside together. You can do that 5 to 10 times. Going to the next side, same thing, thumb into the side here, grabbing with the index, and you'll find that chunk that you're going to pinch, and from there you're going to move it downwards. These muscles are very tender, so don't spend too long on them, and so that you can work on that. But those are some of the easy ones that you can start working on. In treatment, you'll see that I work deeper in the mouth, but they're way too hard to get a hold of without gagging during the process. So usually we'll focus on these external ones first. Try it out.